Well, thank you. And it's just a great pleasure to be back at this meeting again. I can't remember how many times I've been here, but I've enjoyed every visit. And it's always been an exciting meeting and lots of people to talk to and lots of interesting topics. So thank you. So I've been asked to sort of head the start of this debate about maintenance therapy. So I'm going to really review some of the aspects of maintenance therapy without giving detailed trial results, which I'm sure will come from the other speakers. These are my conflicts of interest. So if we go back in time more than 25 years, we established that carboplatin and paclitaxel was really the standard of care for patients, moving first from 24-hour paclitaxel and cisplatin to carboplatin and 3-hour paclitaxel. And you can see that's all very similar, and it's all very depressing because you can see that 80% or so of those patients with advanced ovarian cancer are progressing. And then we spent another decade or
positive cancers since they're so exquisitely sensitive to chemotherapy and PARP inhibitors. And conversely, is there a greater importance for surgery in HRD negative or HRP ovarian cancers? To illustrate this hypothesis, I guess you would expect something like this. So in the HRD group, given the chemotherapy which is following and the maintenance therapy, the outcome should be the same whether or not you have a visible residual disease. If you believe that chemotherapy and PARP inhibition is able to take care of this residual disease. Conversely, for the HRP cancers, where we know it's not as effective, the surgical impact should be much higher. So we have very few data that I could find on the HRD status and surgery.
So good afternoon. I'm humbled and honored to be here and quite frankly intimidated to be in front of some of the smartest and most notable world's experts. So thank you for allowing me to talk about the transformation, the game changers, if you will. That's a good word that you like to use, my good friend, Professor Sahuli, especially in HRD. So these are my disclosures. This is an independent message. So I'm going to start here with the obvious here. And you guys are doing a great job. Oh, there you go. Nice. You're doing a great job in that the mortality rate of ovarian cancer is falling. Thank you. And the incidence is falling. Thank you. Patients, thank you. But there's more cases. There's more cases in the clinic. We're busier. We're recruiting.